Jonathan,
How's it
what's up,
going?
man?
Good morning. How are you?
I'm doing well. How are you?
I'm awesome. Thank you so much for
Nice.
coming on. Been looking
Yeah.
forward to it. I send all my clients over to your page. I think you have like on your Instagram, I think you have like the most in-depth like explanations of everything. And my clients are really into it. I think a lot of people put out good stuff. Like I love Zach Couples stuff. He's really
Yeah.
good and simple, but the way you kind of break down the nuances of it is really, really awesome and helpful for everybody. So thanks a lot for everything you put out there. I know you do a lot.
Oh, I appreciate that. Yeah, that's me. And then I don't know if you know my buddy Encore, Fractal Biomechanics.
Yeah.
He helps with our mentorship program, but he also helps with a lot of like that in-depth like the in-depth content, breaking it down essentially. Yeah.
Yeah, that's awesome. And like I said, you do a lot. I know you just had the webinar you were doing, so I really think you try to like lift up the industry. So thanks for coming on, man. For everybody who doesn't know, this is Dr. Shaun Astorga. You have it's called AMP. Tell me a little bit about your setup that you got.
Yeah. So it's a AMP. I have actually the logo on. I don't know if this is on video.
Yeah.
But yeah, AMP Performance Rehab. So AMP stands for Always Make Progress. So it's kind of like our overarching brand, but we have our physical therapy practice in New Jersey, which I founded and then co-owned with my friend Monica Moore. And then we have our mentorship program is AMP Blueprint, which is kind of like it's our clinical process essentially. It's like, how we help coaches and clinicians kind of turn some of these more, we'll say like complex biomechanics into something that's more of a usable framework to really just help clients, right? And not overthink every step, which is a big thing. I'm
Yeah, I'm
sure
sure
you know.
yeah, I'm sure we'll get into that a little bit as well because it can be like, easy to do too little and definitely easy to do too much in this field. So, I was wondering maybe we can just get a little bit of your background. I always like to kind of talk to you guys, you really great PTs about how you kind of got to your movement models because as we know, like traditional education in PT is important. Like like we use the term dead guy anatomy a lot, and it makes sense, but also I kind of feel like it means that there's no value to that, which isn't true. It's just a part of the equation. So, when did you kind of get to see the bigger picture as far as like when you were along your PT journey?
Yeah, I say I'm still figuring it out, man. But yeah, so that's a great question. Yeah, and I do think like we're gonna probably I'm assuming talk about like one of my mentors, Bill Hartman, comes in is gonna come in here at some point. But he's someone who's helped me kind of make sense a lot of the actual like the traditional type of stuff that we learn in PT school and understand like the context around it. But I would say I don't know, you want the abbreviated version or the long one? I can give you
Yeah,
like
yeah, yeah. Whatever,
the
whatever you think. If you got time, and then yeah, mainly
yeah.
like the like what inspired you? Like what
Yeah.
pushed you to make the change in the thought process? Yeah.
Yeah, for sure. I mean, for me, a lot of it goes back to my own kind of journey with injuries. I played sports forever. When I first became a PT, it was a second career for me. So I became a PT, and then early in my career, we'll say like 2014, 15, I hurt my back playing in a flag football charity tournament. And I had like the leading up to it that week, I did like this like CrossFit workout. I did probably like a million deadlifts, and then like my back just like went to shit afterwards.
Yeah.
And I was recommended not to play, but I decided to play. And like the second play off the line, I just felt like someone shot me in my back, like something popped, and then I had pain shooting down my left leg. And I got treated at work, more of like the traditional kind of like core stuff and like some manual therapy and not bashing that stuff. There's a time and a place, but I
Like
wasn't
like
really.
the McGill Big Three kind of stuff, or what?
Yeah, we were doing like clamshells, like bridges, like all that kind of stuff. I'm a new PT. I was in like the finance world
Yeah.
before. I didn't know what I'm doing, man. I'm just following along here, trying to learn like anyone else. And like one Saturday, I went in and I worked with the physical therapist who was covering it at the time. His name is Joe Myron, and he was like, obviously, like what you guys are doing, is unfortunately it's not working. Or like, you cool if we try something different. I've been learning this stuff, and it was like PRI at the time. You had taken like a home study or two or something along those lines. And I'm like, yeah, like I'm pretty open minded. I'm like, I'll try anything if it's going to work. He did some of the manual therapy, like to the rib cage, and I'm like, oh wow, actually, I feel like the pain in my legs kind of like going away. Like this is kind of interesting. And then we did like your typical like I don't know if you've taken like any of their courses, but
Yeah,
like
yeah.
their
I've done
myo.
all the three basics in the cervical. Yeah.
Yeah, awesome. Yeah, so like myokin, right? Everyone learns like the
Oh yeah.
90-90 hip lift, like right sideline, left adductor pullback, right glute max. We did that, and I'm like, actually, like I feel like way better, like night and day different. Still had stiffness in my back. I don't like to paint the wrong picture, but that was like my first like introduction to something that was a little different than what I thought physical therapy could be. And I just kind of like went in and took a bunch of their courses in a short period of time, which I don't recommend doing if you want to like if you want to like synthesize it and understand it. So that was kind of like my journey into like a different way of thinking like about things. And that time was like pretty influential because I met I went to IFAST, Indianapolis Fitness and Sports Training, their facility for a PRI course, and that's where I met people like Pat Davidson, Bill Hartman, Mike Robertson, a lot of people in that world. Lucy Hendricks was there, like a lot of people I'm friends with now. And I didn't know it at the time, but like they become all very influential on me. And yeah, Bill Hartman and Mike Robertson, they had something called IFAST University. I don't know if
Yep.
it's still around at the time, but I'm like,
No.
oh wow, interesting. Yeah, like well, this is like what we were working on like as we started learning this stuff. It's like how do we kind of like bridge this gap into like the fitness world, and how do we take these concepts and like make them something like more? Because obviously, like you got to progress people and all that kind of stuff, and they were doing it. So I'm like, oh wow, this is awesome. Like we found this thing, and then that was kind of like the background there. But then in 2017, I suffered another injury. I suffered a brain injury and an upper cervical injury,
How did
and
that
it didn't.
happen?
Yeah, oh wild man. Yeah, yeah. I was it's so stupid too. Like I'm talking about playing football. I played basketball like my whole life. And it was just at work one day and I was looking down and two boxes, they fell off a
Oh,
cabinet and they
fuck.
just hit me in the back of the head. Yeah,
Jeez.
yeah. But it didn't heal well. It didn't heal like you would typically expect. And while I was out of work for that year, it was around the same time that like Zach Couple started putting out a lot of content. Bill Hartman started putting out a lot of content. So I kind of like just spent my time like learning from them. And I'm like, oh, okay, cool. Like this kind of makes sense. Like I get this. And it was around that time when Bill started doing the intensive. So it's like his like mentorship, like the live portion of his like
Dude, I
mentorship
was I
program.
was signed up to do it out here in July in Santa Barbara, and they had to cancel it. They couldn't get enough people. I was so freaking bummed, man.
Oh, really? Yeah, yeah. So
Yeah,
this is like we're in like 2000, probably beginning of 2019, I think. I went to like the fifth rendition of it, and it's changed a lot. Like his
yeah.
model just progresses, right? It's his, which is cool because you see it in real time, like his progression and thinking, and it's been helpful from that perspective. But I went there and I like, went through it, learned from him, and I worked with Mike Camperini, who is, is a longtime student of
Gamperini
his, and
deadlift. He's got a
yeah,
move
man, the
after him.
Campo deadlift, man. He's got exercises named after him. I work with him, and he kind of helped me get over the hump. And then now I work with my friend Greg Hawthorne, who does all my training. He helps me in the mentorship program. Yeah, so that's kind of like my journey into like all that kind of stuff. That experience with my head injury is also what led to me opening our practice. And yeah, here we are, man. Now I'm just trying to figure shit out like everyone else. So
Yeah. So you said you were in the finance world before you got into PT?
yes, yeah, yeah. I was in the finance world, so I worked on Wall Street for a short period, and then in corporate finance for maybe about 7 years. And then,
Okay.
it was just not what I was. Learned a lot of very valuable skills, especially now I'm like a business owner, right? So, it translates, but not from a fulfillment standpoint at the time. And then I got kind of like the push into uh, the physical therapy world because that's kind of where my interests were in like training and sports and like all that kind of stuff.
Yeah. So how old were you? So you went back to school. How old were you? Went back to school and did everything.
When I graduated, I was from PT school, I was 30, 31, something like that. So I was probably like 27, 28 when yeah, I had to do like all the prerequisites too. They didn't like
Yeah.
want my like rock science, like geo or earth science.
Exactly, right?
I took all like the BS stuff on undergrad just to like do it, and then I'm like, oh crap, no, I got to take all the anatomy, physiology, all that kind of stuff. But yeah.
Yeah, that's interesting. I mean, my background was in finance. I never really got into it because I graduated right when the world fell apart in like 2008. So it was like
Sick
it's like
timing, yeah.
yeah, exactly. So I mean, it does help as a business owner. Before we get into all the like the fun stuff, I was just curious as we're on this topic. I saw that you talked about how you'd use a business coach as well when you were growing your business, and
Mhm.
that's pretty interesting to me, especially coming from like a finance background. How did that like work for you? How did you decide to do that?
Yeah, so I started my PT practice. Well, you mentioned when the world shut down 2008. So I started my PT practice when it shut down again in 2020. So I had a big learning curve. Yeah, and I kind of like got into it just as um like like the typical, it's hard as a PT to work for someone else when the values don't align and you're seeing a large volume of patients, all that kind
Yeah.
of stuff. And I just figured, like, you know what, I'm like a pretty decent clinician. People like working with me. Like, I'm just gonna go out and start my practice and people are gonna come to me and it's gonna be great. And that's like not how it works at all. Yeah. So so yeah, so like it was really just, we had a lot of like ups and downs
It
trying to
was just
figure
you
out.
and the one, I'm sorry, what was her name at this time?
Monica. At this time, it was just me. Yeah,
Okay,
at this
just
time it was
okay.
just me. Yeah, yeah. But yeah, so she became like her journey is interesting too. So she was like contracted with me, then an employee, and then partner in 2023. Just as I started doing more, like we needed someone to kind of help run the day to day and all that kind of stuff. But yeah, it was just a lot of like up and down months. We didn't have any consistency or anything like that. A practice in by me, Strive to Move. I've been following their stuff just because they're local for honestly for like Facebook days, like 2015, 16. And his name's Justin Rabinowitz. He's a friend of ours. A lot of people in my circle kind of know him. The gym owner where AMP is, he knows him. And he started doing business coaching, and people I knew worked with him, and they had a very positive outcome. And we've been working with him since end of 2022, something like that. And
Oh,
it's been great, man. I'm a big proponent of learning from people who are doing what you want to do at a higher level. I think it's just like the fastest way to
exactly.
right so like to do the thing, right? And it saves a lot of headaches. And I'm like a stubborn person. Like I'm like, oh, I could do it better, I could figure it out. But like ultimately when you have that like guidance, it's like it just kind of like I don't know, it's like just adds like fuel to the fire, and
Yeah.
it makes it move a lot quicker.
And
Yeah.
so he was kind of local to where you are too.
He is local. Yeah, they're probably like half an hour from our practice.
So that
But he
probably
works
helps
with.
too. Yeah.
Yeah, yeah, and it's the same type of model. Like we don't work, we're not like oh, do you take my insurance? Yes, just come in kind of situation.
Yeah.
Like people are investing a lot to work with us, right? They pay out of
Yeah.
pocket. So their model is similar. We have a similar population. I'd say ours is like slightly different. Yeah, but he coaches people everywhere. It's not just here. He just
Yeah.
happens to be local to me. Yeah.
How have you seen that like the cash-based PT business model like change since you started? Because when I started it wasn't shit really. Like I worked with a PT and a trainer, and I was trying to decide if I wanted to potentially end up going back to school to be a PT or if I wanted to train. And at the time, it was like cash base was really foreign back then. It was like you were saying, get people in and out, do the shoulders, spend 20 minutes with them, put them on the bike for 10 minutes.
Yeah, that's a great question. How has it changed? Like I will say it's hard to say because my perspective is like I'm friends with a lot of people who are like they own their own practice that is kind of similar, in terms of cash based. So my sample size is that. But when I think about like just locally, like what I see around us, like we're a small town, 6 other PT practices, and we're the only ones who are cash based.
Are you
So
where are you
like
located?
Chester, New Jersey is our
Okay.
practice. Yeah, we're in more like northern New Jersey. People in our
Yeah.
county don't even know where Chester is. It's like, it's just out there. But yeah, like, like you don't see it, like it's not like heavily concentrated. Like we have friends in like different counties, like in Jersey, from the cash space world. Yeah, I don't know if it's much different though in terms of like when I started to now. Yeah, it's hard for me to answer that.
Yeah, I feel like at least where I'm at, I'm in Newport Coast, so everyone's kind of like on the edge and they got cash to spend, they're always on the cutting edge of everything. But I feel like just from a general population standpoint, people are kind of getting the point now that's like, okay, like normal PT is like hit or miss. Maybe you get lucky,
Yeah.
but like all my clients are like, I'd rather pay cash and get something fixed in a short amount of time than spend forever dealing with this. So
100% from that. I think I misinterpreted your question. My bad. Yeah, yeah, 100% in that perspective. Like from like our patient population, people are like, how do people get their head around like paying you? I'm like, I don't know. Like, like I think people are so like they're this like, okay, this is my perception of PT, and what you guys do is so different.
yeah.
Like you go read a Google review here. It's like I got an ice pack and whatever hot pack and didn't get to what I needed. And then, oh wow, this place seems to like work with people who went to PT and it didn't help. And now they can like get on to doing whatever the active thing is. Yeah, so there's definitely been a change, I would say, in like public perception of probably healthcare in general, but definitely
Yeah.
in the rehab space. And
Yeah.
we are our clientele is what you just described. It's like active people who are doing stuff. It's
Yeah.
like I need to compete in this race and I have this injury. I am competing in this competition and my knee hurts. Like that's the type of person we're working with mostly. Yeah.
Yeah, and sometimes those people, it's hard to like get them to do everything that makes them better. We'll get into that a little bit about managing that and interference. But yeah, like we were talking about like the whole dead guy anatomy, and that's
Mhm.
what you were saying. You wanted to kind of translate that to the weight room, and that's something that I really kind of like realized in like a PT environment. It was like, okay, if we're looking at things as a dead guy anatomy point of view, where it's just point A to point B, where and like the the planes of motion and all that, we're kind of missing the whole impact the structure has on everything. And then same thing in the gym. It's like, okay, no one's really thinking about the impact of your structure. They're just thinking of going from point A to point B, moving max amount of weight, not taking account compression or, muscle orientations, fluid dynamics, all that kind of stuff. So
Mhm.
I was thinking maybe we could just start with like I talk about the rib cage and pelvis all the time, like the rib cage, pelvis, and foot. And I guess depending on your lens, sometimes the cervical spine, but mainly the foot, pelvis, and rib cage. Those are kind of like our foundations. And maybe you can
Yeah.
talk about how those kind of play into our movement variability options and our ability to produce force and how it relates with the propulsive cycle, if you think that's good to start with.
Yeah, yeah, cool. Where do you think's the best place to start? Um,
Maybe we can talk about how like the changes you might see in like pelvis, rib cage, foot position based off of certain compression strategies you might expect to see from
okay.
a bodybuilder, someone producing a lot of force.
Yeah, yeah, for sure. Yeah, so I mean, and this is like I've learned from a lot of people. So some of the stuff I'll is going to be like I always just recommend people if like you want to learn Bill Hartman stuff, like go to
Yeah.
Bill and like learn from him. I like to always just put that disclaimer. I already mentioned like PRI. I also have a background with like DNS courses, so
Yeah,
there's like a lot
DNS
of
as
that's going to
well.
kind of be in here. And they all kind of say similar things in a different way. What I really resonate with Bill's model, and again, this is my interpretation, is I really like that he starts with the structural archetypes. Because that gives us an expectation. It gives us a basis for like, okay, here's this person. I can look at them. They're like a narrow end of the spectrum or wide end of the spectrum type person. And that's going to give me some kind of idea of the things they're going to be good at from a movement standpoint and the things that they're going to probably like not be as good at. So I always like to start there. And you mentioned the word like compression or like how the body might compensate from a like force production standpoint of people who do a lot of like bodybuilding is the example you use, right? So I think of like compression expansion, like compress is we get smaller, move towards midline, right? Expansion is we get bigger, we move away from midline. So ultimately, like the rib cage pelvis, it needs to be able to kind of go through some excursion when we breathe, right? So it needs to get bigger and smaller as we just take normal breaths in. And the sports that we do, the stuff we do, injuries, like our general health, all kind of impacts the ability for that to happen. Like you could have a situation like I run, so it's very easy. Like I literally run long periods of time at different speeds in a straight line. So your body is going to naturally adapt to get good at that sport, right? So for me, it's going to reduce certain spaces in the pelvis and rib cage. It's going to restrict certain ranges of motion. And it's like, can my body recover from it? It's like ultimately how I kind of think about things. But when we're looking at it from the perspective of just how we move, and you mentioned like variability, it's for me, it's always like what's realistic for the person and they're trying to do. It's like there's not like a magical number of amount of range of motion a person needs, right? It's just like do they have enough to do what they want to do and like feel pretty good and be able to recover from their situation. And that's like a combination of I mean, it's a lot of things, man. It's like load management in general. It's the foot, like how we use our foot to load our joints. The intensities we work out, volume, all that kind of stuff is going to kind of play a role in things.
Yeah, and then I would say in bodybuilding, there's been like kind of a crossover. Like people think like powerlifting technique equals maximum like muscle gain, which I don't think is necessarily true. It equals maximum like strength. And a lot of people they use that technique where they kind of create like excessive compression to be more stable. Maybe you can go into kind of like some of the changes that occur as we start creating that compression as far as like we can start getting it affects everything peripherally, right? Now we're going to have
Yeah.
certain muscles that are kind of better at producing force, certain ones better at yielding. We have the connective tissue impact, right, where we have
Yeah.
some connective tissue that doesn't want to yield at all, and then it just affects everything downstream. Can we go into kind of the relationship between that and the
Yeah,
pelvis and
yeah, for
rib cage?
sure. Yeah, yeah. So like a lot of like I don't, it's not like picking on powerlifting, but you like, since you use the example, right? It's like creating a lot of what we would call posterior compression. So compression on the back side of the body. So essentially, if you just like squeeze your shoulder blades down and back really hard, you're going to feel your center of mass kind of gets pushed forward a little bit. So that's going to create a situation where like it's going to be very good because you're reducing rotation in your body. So it's very useful strategy for like lifting, like you said, right? Maximal loads. But there's going to be other adaptations that happen. One would be like stiffening of the connective tissue, which is going to affect energy storage and release. It's also going to have adaptations on your skeletal structure. So it's going to we talk about it from the perspective of like it's probably going to lateralize everything. Meaning it's like if you think of ever seen like shoulder impingement, like a person right there in the frontal, like in the front of their body, their shoulder gets stiff when they try to elevate their arm and they bring it out to the side and they have more motion. That will be like a lateralization. You're reorienting the joints so they're kind of more out to the side. Same thing happens in your pelvis. So that's why like people when they have trouble squatting to depth, you just bring their feet out a little bit wider and they can like now squat deeper. So you'll have those kind of adaptations on the body as well. From a movement, just a general movement standpoint.
Which is always important to like take note if you guys are ever running like table tests and stuff, right? Because it's like
Yeah.
you might be thinking someone's hip flexion is good, but they're skewed out and they're in an ER space, or you might think it's, you might have them so far in that they don't have any internal rotation space to move into, and so you got to take
Yeah.
all these things into account and know what's real, actual real test. Now, something I think I don't know, I don't really have any evidence behind this, but I'm curious on your thoughts. When we are kind of creating stiffer connective tissue, to me, that means it's going to get kind of bunchy in like certain areas and a little thicker, right? I'm sure you've done cadavers, right, where you've seen certain like bunches of fascia where it's like, what the hell? And then other ones where it's kind of not quite the same. Now, I wonder, do you have any thoughts on how that could impact like potentially muscle separation or aesthetics at all? Because I don't really have anything but I really do think it would like limit separation to a certain degree. And you see it when you see like powerlifters step on stage versus somebody who's been trained like a bodybuilder.
Yeah, yeah, for sure. And you see it like sometimes like I'm thinking of like basketball players. I don't know why they pop in my head. Like where they have like those like sinewy like looking muscles where like I always think of like the pec. It's like they're very like I'm gonna use the word compressed, like their anterior chest wall is very like caved in and their pec almost looks like it's just like contracting and
Yeah.
you can see the tendon. That's kind of what I think about there. From that perspective. So it's definitely going to be a thing. And you think of like, I mean, bodybuilding is not my sport, so I could be talking out of my ass here, but like anytime I've ever seen a bodybuilder, it's like everything just looks very like just
Yeah.
big and open, right? Like, I mean, it's like the goal of the sport, right?
Push forward. Yeah.
Yeah, yeah, but like the muscles are just like very like there's a lot of volume to them, versus the opposite. And you can also get like motion like this might maybe where you're going here. Like you can get motion from the like the rib cage and the joints, right? You can get it from the connective tissue, like stretch or yield. You can get it from like the muscle itself. So there's also going to be like, a little bit of that balance as well.
Yeah, that's something I always talk about is when someone is like I mean the easiest thing you can do to promote like keeping relative motion when you're working out and to keep tension on the muscles is just keep your stack the best you can. And that's something I always say is once you start losing that stack, you're dispersing it. We're getting it just in the compression, the axial skeleton, like you're saying, just in the connective tissue. And that's a concept that a lot of people like they just think like if it's just the weight though, it's more weight. So it's got to be more stimulation on the muscle, but it's getting distributed everywhere. So there's a fine balance that I mean no one really knows, right? Because you need a certain
Yeah.
amount of orientation to get a good amount of force production, but too much and it starts going everywhere else. So that's always kind of what I'm trying to balance is how should we work out optimally for like aesthetics versus just force production. So continuing to
Yeah.
learn that and obviously the way we work out can also impact your ability to present your body too. If you are like competitive, it's going to be hard to do things to show in a good light if you're squished everywhere and can't rotate at all. No, no,
Yeah, yeah, for sure. Well, just real quick on that subject, one thing that we use a lot is we don't have like I don't have access to a gym aware or like any of like the velocity based stuff, but I do find that to be very, very useful for managing that process, especially in like my own training. Like the biggest thing for me with managing is like anyone really. It's like load management, but like I do a lot of running and I also like don't want to like shrivel up and not have muscle mass. So like it's always like it's like balancing that. So what's been helpful for me where it doesn't my lifting doesn't detract, at least I don't think from my running, is I kind of use velocity drop off and it's perceptual. Like I admit that I don't use anything, but like when I have that velocity drop off in like a squat, for example, or I have to like I'm like, oh, if I do another rep, I'm probably gonna have to grind in the bottom position. Like that seems to be like a good just like mental framework to have when I'm training. And we use this in our practice as well, like when we're working with people, especially with when pain's a factor. It
Yeah.
gives them just like, all right, we did this rep and like you saw how hard you had to grind. Like next time we're gonna like just stop right before that one. And that seems to be a good way to like mitigate some of that those secondary like negative kind of consequences that we might not want at during training or more specifically probably rehab. But
Yeah, that's something I talk about a lot too in terms of people use like reps in reserve in like the bodybuilding world. And it's like, okay, well, if you leave one rep in reserve and then, but that by that point, you're all just fucking splayed out and looking like shit. Like maybe we
yeah.
should have stopped a little sooner when you felt like you were just about to lose it. Or like you said, maybe as soon as velocity starts to drop off so we don't try to compensate and get more. And that's a skill set too. Some people are really good at squeezing everything out without having compensations. And some people really struggle to not compensate like way earlier than they probably really need to.
Yeah, yeah, and there's other ways we do it. Now you got my maybe the caffeine's kicking in, man. I don't know, but like we also the especially like again, remember my context is more on the rehab side, but a lot of times like it'll be do like alternating dumbbell presses, right? For variability, whatever terminology we want to use, and it's always important that the execution matches the intent. So if you're doing alternating dumbbell presses, but you have to hold your breath because the load is so heavy, like we're not getting the outcome that we want, right? I'm not saying it's good or bad. I'm just saying it's not the outcome we want. Versus like you can, like you're exerting effort, but you're probably not like in an RPE 8 or something like that. Is also important, just like understanding like the context that we're kind of working in, because then you can get like carryover in some of these things, maybe build some more resiliency to like maintain this like relative motion or like that kind of stuff a little bit.
Yeah, which is why a lot of times, right, we remove gravity or try to do
Mhm.
something to get them to be able to produce force in a way that is going to promote what we want. And then we try to progress them to be able to do that under more load. And that's always a challenge in itself, right? Trying to figure out when we're ready to get past the more like basic breathing drills and get, especially if you are dealing with pain. And most of my people, I deal with pain. Like I have bodybuilders that are like
Yeah.
just fucked up. Usually I don't have bodybuilders that are coming to me trying to like look good. And then I have all my Gen Pop people who they want to like look good and just feel good and be able to do all they want. And they've been with me for like a decade now, so they've been able to see the evolution. So they're all pretty pain free. They don't have too many issues. But when you are dealing with a patient who is dealing with usually like I'm assuming you're like me, you get more of the chronic stuff, right? You probably don't. I mean, obviously you get some acute stuff, but that's where the whole thought process of it being like a positional issue really comes into play. So how do you have like a framework that you use when you are trying to kind of help someone fix their pain and manage their ability to produce force and as you're transitioning them back into doing
Yeah.
the things they like or just back to the gym?
Yeah, yeah, and that's really it's very true what you just said, the chronic stuff, because I think that's important to appreciate because these are adaptations, right, over time, and I think especially when you like people start learning about like some of the compression expansion type stuff, it's like you think about it in two dimensions, like cross syndromes and like all that kind of stuff, but it's really that component is the 3D effect, and then how it's like transpired over a period of time or whatever. Yeah, so the framework that we typically use is we got to assess like a starting point, right? Relative to like what they're trying to do. And that usually is like, do they even have the motion that they need to like, you know, not overload structures or whatever the situation is. So step one is always going to be just restore some form of motion. So usually it's like either at the joint level or even globally. From there, we call it like pressurize, and that's going to be more of your breathing drill, and then like progressive kind of breathing drills. Like what is the position we can challenge them in, where we're going to be able to get the rib cage to compress and expand. And then from there, it's like where can we start from a building capacity standpoint that's relevant to their end goal. That's a general framework that we work in. Obviously, there's like a lot of nuance depending on the person and their sport, but that's typically how like our thought process behind how we kind of approach things.
And like, how strict are you? Like when you're progressing them, like is there a certain pain tolerance you're okay with? Are you like you have to keep that foot contact and it can't move at all? And if you move there, we're gonna wait and see because, like I said, it's always real
Yeah.
gray in there.
Yeah, yeah. I would say I am not super strict in terms of a lot of things. Like I think of like I always think of myself, right? So I run and I run I'm very active just in general. Like it is probably unrealistic for me to have my foot contacts even on my like right side all the time. Like it's just not realistic. So for me, it's like, can I do stuff where Like I have my routine that I got from my buddy Greg. It's like, can I restore enough motion that I can get my foot contacts down, knowing that when I go out and run, these things are going to go away and I don't have any symptoms or anything like that. So like I'm kind of cool with it. So we kind of approach it from that perspective. It's like if you came in and you were having like knee pain with squatting and you don't have any motion in your right hip, like I'm probably going to emphasize like getting that back. And then it's a little bit of trial and error. Like, let's see what we can get away with from, all right, we're going to get you back up and we're going to be doing some kind of like, I don't know, like a supported squat. Do you maintain your motion? Cool. Like, can we progress this a little bit more? Like, that's very much how we do it. So it's really like, I guess if I had to like sum it up, is like having an educated starting point and then kind of seeing what the person, what happens once we put it into action.
I get one thing that I get lucky with is, like most of my clients I have, or if they come visit me, they come back and forth. Is it's easy for me to get kind of like KPIs to already know, like beforehand, like to go back to. Whereas for you guys, you're kind of probably more trying to establish those as you're going along.
Yeah, well, we do have those as well, right? Like, so some of them might be range of motion in the beginning, and it might just be like we did something, we improved internal rotation, and then we did something that was more like higher demand, I guess, and they maintained it. Like, okay, that's a useful KPI. We also have like your like you're not going to go back to running again. It's like we have like your splits, your tolerance. You can run X amount, and then it hurts, and then now you can run longer. So we do kind of like track those things as well. We use dynamometers in our practice as well to kind of gauge like strength output and I guess more local, obviously. But we use that from that perspective as well, just to have some kind of objective to track things. Yeah.
I want to get back into kind of just the relationship between everything real quick. I was thinking like for most people that are producing, I mean, even if you're an athlete, right? Like usually we're in well, we like if you're like an athlete moving forward in space, right? They always say like look at LeBron's feet or look at Usain Bolt's feet, right? They're in that very late propulsive. Is that the kind of terminology you use from Bill for the propulsive cycle? Do you go through that stuff with your stuff?
Yeah, like we relate things usually to that. I like that framing because
Okay.
there's there's like context to like what it means, right? The joint
Okay.
positions, yeah.
Yeah,
So
just
I'm
want
cool
to
with
make
that.
sure
Yeah.
that I just want to make sure that's a term that you use. I know some of them, like we talked about, but Bill like puts out so much, and it's his baby, so it's like he has to keep things a certain way and be so
Yeah.
like thorough with it, which is great. That's why he like puts out such good stuff and inspires some people. That's also why
Yeah.
he is like the smallest he is, though, and I think he's fine with that.
Yeah.
But
Yeah. Yeah. It's a it's a niche crowd, man.
I was wondering, like, maybe we can speak on kind of the
Yeah.
relationship between where we would be, like, like a lot of times, right? People, especially if they're more narrow, they might be kind of like not able to access late propulsive that well if they're really
Yeah.
turned, or we've potentially got the powerlifter duck-footed person who is kind of just in late propulsive in both in no man's land, totally flat foot, ER'd everywhere. So maybe can we go into like the relationship between the propulsive cycle with how it incorporates to like the feet, the pelvis, potentially the rib cage.
Yeah. Yeah, for sure. And LeBron's a good example, man, of like this person cannot. I don't think he's ever had
Have you
foot
seen him
contacts.
squat?
Yeah, exactly. That's what I'm saying. Like, so it's like always good to have these framings. And again, like we don't know what he feels like, but he has one of the most like his career from a longevity standpoint is insane. Like the dude's my age and he is playing at, I would say, like a very high level still.
Yeah.
So like when we talk about all this stuff, like I never want to paint the picture that like, it's anything more than it is. Like this guy's toes are like curling under his foot. Yeah. So, sorry, the question was about the propulsive
Yeah, maybe how it affects
cycles.
the shape of the things and how they interact, and then maybe a couple strategies we could use to like get into a better position to have more options if we are stuck in one phase of the propulsive
Yeah,
cycle.
yeah, yeah, for sure. So like the way I'll just tell you a little bit about how I kind of think about it. Again, not saying I'm right, but this is just the framework that I have in my brain that is helpful for me. Is I remember like I just think of these as like they're phases in time, right? Early, middle, max, late. And each phase, right, we just have to remember that it's a transition right to the next phase. So if you're in early, you're going to have an ER bias to your foot, so more supinated foot, and then it's going to be more ER bias all the way up, and you're moving towards pronation. You get to max, right? Like that's when your heel's going to break the ground and everything's going to go in the opposite direction. So now you're going from pronation, more rigid foot to supination. So when we start to lose our, I'll say like joint motion or whatever it might be. You'll hear people in our world say like your center of mass gets outside your base of support. Like
Yeah.
when that starts to happen, we lose our ability to kind of move through that nice like the propulsive cycle. So we lose our ability to load the heel, right, to keep the lateral contacts, load through the medial, like the medial foot contacts, all that kind of stuff. Um, so when some of the adaptations that you're going to see is it's all based of like where your center of mass is, right? So people will their tendency is going to be to go forward and to the right in some capacity, regardless of your archetype. Just like how you get there is going to be a little bit different. So from like a reverse engineering it standpoint, it's like usually we got to make sure they can get the right foot contacts down on the ground. That's a combination. It could be of dude, who knows, man? It's like restoring motion locally, like at somewhere in like along the chain. Bringing we talked about lateralization. I don't know if that is a concept people resonate with, but like getting the reorientation of the sockets, if you will, so that they're more
Yeah.
forward facing,
I
so
talk
we can
about that
kind of
all the
load in.
time in my videos. So they know what's up.
Yeah.
Yeah.
Okay. Cool. Yeah. Yeah. So I don't know what language people use, man. Yeah. So it's like getting that kind of situation, and then also like I think underappreciated is just working in the plane like that people have available to them, or like where people have motion. So it's like there's nothing wrong. You'll see in a lot of our content we put like people's feet out wide. We use the fencer
Yeah.
squat position, like the sumo squat position a lot. Chops in that position is very useful because most people have access to that range in some
Right. And
capacity. So it's
if you take a side, but if you, yeah, right, I
you're
do the
good.
same because if someone even sometimes even they do have access, they're just not fucking good at it, and you just need to give them more
Yeah.
space. Like especially you real compressed narrows, right? You guys are like so subtle with the things you can do, whereas like the wider is a little easier to see, and like they can feel if they're doing something weird. So yeah, sometimes you got to give even
Yeah.
more than they actually may need realistically to get to it.
Yeah, yeah, but it's a super useful position for a lot of people. We do it a lot, man. I keep going to running. Your audience is probably like, what the hell is what sport is that? It's
No,
like
I have everybody on here. I had Alec Glennis, who's an ultra marathon
oh,
guy.
okay, yeah, yeah,
Yeah.
awesome, man. Yeah. But like even like sometimes during like intervals, like the rest period for like a lot of like 400-meter repeats, it's like literally just bang out like 10 fencer squats right side first, then go left. Like, yes, you're orienting and we're not probably like getting like optimal whatever, but you're also reintroducing internal rotation and getting that foot, the medial foot contacts, like some kind of ability to like produce force again. And you feel like it's anecdotal, of course, but you feel just more springy when you do it. So we use that kind of stuff a lot in that from that perspective as well. But I think there's a lot to say about that, like keeping the feet in a position and the arms in a position that you just have motion available in.
Yeah, that's something I speak a lot about is obviously the foot contacts, the head position, and then the hand contacts on the ground or on the bar too, which I think most people overlook. And I've had some people just write me like, "Wow, now my elbow pain is like just gone just by focusing on the hand
Dude,
contacts."
yeah, it's wild, man. Even with like we'll see it a lot with like dumbbells too. It's like they'll have everything kind of like in the crook of their hand between like the thumb and the index finger, but nothing on like the
Yeah.
pisiform. And you're like, just like let that dumbbell like just put some pressure through that, And it's like, oh wow, yeah, like, elbow doesn't hurt anymore. Like
And the old me,
amazing.
when I was, fresh babyface trainer, a long time ago, like I would be like trying to get the elbows to go where I wanted to try to get and really just hold it like you want, keep your ribs under control, and it does what you kind of were trying to get them to do anyway.
Yeah, yeah, we very much apply stuff in that sense because it's ultimately like to your point, right? You're kind of like comes back to what is like practical for the person I'm working with. Like I have yet to meet a person where they're like they care about any of like the in-depth stuff. They're just
Yeah.
like, just make this shit feel better so I can like lift more weight or run faster or do whatever. Like that's all they care about.
Yeah. Maybe like real fast as we can. We could dive into just real quick about the different pathways that the different structure types might take. You were mentioning they end up in the same spot, kind of like forward and to the right, but they kind of have different ways to get there. And most of my audience, they know that the narrow ISAs, they're gonna have probably an earlier turn than the wider guys. Typically, when you see the narrows, they're gonna start going to the right a little sooner, right?
Yeah, this is like my first introduction to this was probably PRI, like understanding their underlying kind of like they don't call them archetypes, but whatever they call them. And then like from Bill, I got further clarity on this, and the way that Bill describes it makes a lot of sense to me. So when he talks about the archetypes, so you think of like the narrow, you have your, can I say like lower posterior compression, like all
Yeah,
that kind of
yeah.
stuff? Is that cool? So like the lower posterior, so below the trochanter, like that's what drives a lot of the the turn right on a narrow. So that's why you're going to see that kind of like left side get ahead a little bit faster right on them versus a wide where they're kind of more in that like anterior pelvic tilt bias position a little bit, right? So they're up and over a lot quicker on the right side. So ultimately, like you kind of like get to the same spot. It's just how you get there is probably what's going to be the a little different.
And so how you would move them back would be slightly different then too, right? You got to reverse engineer a little bit.
Reverse engineer a little bit. Yeah, yeah. So like when you have like a narrow, right? My goal is going to usually be to get more like verticality on the right side, and then be able to get their right foot contacts, and then we can kind of start getting the turn to the like the push to the left. Yeah, versus the like someone on the wide, I might be thinking about getting their right side back a little bit sooner or first probably to be honest. Yeah,
Yeah, it's kind of
yeah.
like with the narrows, like, and it is. I started with the PRI before I got into any of Bill's stuff, so that was my kind of original lens to look through it as well. But it's like if you look at it from like a PRI lens, it's kind of like it's a lot easier to find the right side to find one side of somebody on that's a narrow, whereas the wider's kind of in the pec patterns in no man's land. You kind of got to get them to feel one side,
Yeah.
so then we can get out of it a little bit. But something like I do with PRI, I try to get out of the right side a lot quicker than kind of what they usually kind of recommend it when they have their sequencing. Is that something that you do with narrows? You try to get them lateralized over as like quick as you can out of that stuck side?
Yeah, yeah, I would say so. Yeah, yeah. I like that's kind of how I view getting the right foot contacts is almost like squaring the pelvis a little bit, and then it gives you the opportunity. I would say one big difference, and this is honestly, I always like this could just be my at the time my application of some of the stuff I learned from PRI, is like even now when I'm thinking of like hip shifts and like loading into a hip, it's so subtle compared to
So
like when I
subtle.
was doing.
Yes, yes.
Yeah, and again, I think that could just be my application of their stuff. So I
No,
don't want to
that
paint the
no.
wrong picture,
Yeah,
but
yeah. I mean, I do feel like the people that know their shit, they're doing it right, but maybe the way they convey it isn't because I think I definitely overshifted and I created major issues with myself. It's always
yeah,
always good to
but
test with yourself first. But I was like, well, now I'm in a right AIC. What did I do to myself? Like,
yeah, but like it's like that's one major thing and again, like I don't think there's anything bad. Like I know the word orienting gets like has a negative connotation for some reason. Like I don't think it's negative. It's just like describing the situation is how I think about it. And there's like benefit to that. And I think in some,
yeah.
especially with pain. Um,
A lot of times you
like
need
you
to orient before you can capture the relative, right?
Yeah, yeah. Even like someone just has like a ton of pressure on their low back and you just get them to like orient
Yeah.
everything bawords. Like a lot of times that does help them feel better. But I don't even know where I was going with that. Yeah, I have no idea, man. I'm just rambling now. So
No, no worries. Well, with the narrows, one thing that I typically just end up have seen, like I don't know if I've heard anyone like say this. I mean, maybe Zach, I can't remember, but I mean, for them, I feel like when they're pretty much at their end game and they're closed down, they have like just so much like. I don't know. It's like they have more movement options, but less movement options in some ways. It's like they compensate so effectively. It's hard for them to even get like tension on their muscles. And so when they're like at that latest stage of compensations, you say your narrow who's in a lot of pain, I tend to have them focus on a lot of posterior expansion. That seems to be like a big one. Is that something that you see, and why do you think that is? Can you speak on that a little bit?
yeah, I mean, I think that's a good thing to go after the posterior expansion in general. Like that's always like we joke is like when in doubt, like
Yeah.
just get some AP to expansion and cross your fingers. Yeah, I don't know if that's something like I would say I've seen that for sure. But I also see the opposite where it's like they're just very, very rigid. And some of this could be too, like how we measure like joints. Like I'm pretty strict with how I measure like table test and joint motions. I know that's like a something like especially with like the people in our mentorship program, they're surprised to see like, oh, that's where you guys would stop your table test kind of thing. So there might be a component of that. Yeah, I don't know if I have a good answer there. So we have some
Yeah.
of those like people they're like hypermobile, right? But it's really to me it's a lot oftentimes it's a lot of spine motion that
Yeah.
that looks
That's
like joint motion. So it's just like kind of differentiating between that, but anytime someone is on that like and like use the word like end game or like right like a narrow like a hard right oblique turn, there's like not a lot of motion left. Like my assumption would be that they um that's the situation. Like if it's motion that it looks like motion's available, it's probably coming from the spine.
Yeah, like they're so subtle. It's always like the yoga girl or something. And then when they're that compressed, I mean, they're always missing IR and they need that anterior expansion too. But I feel like whatever it is, like their lack of ability to get that
Yeah.
thoracic to expand like posteriorly, the rib cage, they'll just immediately kind of bypass like tension on the muscles. Whereas like a wide, they can be really posteriorly compressed, but for whatever reason, like their compression is so much more subtle. They're able to like at least kind of actively keep a little bit more on the muscles than the narrows.
Yeah, I get what you're saying. Yeah, yeah, for sure. And then also you have those like those kind of like narrow, but they're very like or narrow structure, but they're also like narrow A to P, like those kind of rib
Yeah.
cages. And they're very just like I don't know that the word is stiff, I guess is the word. And then like they'll have like 120-degree like straight leg raise, like
Yeah.
that kind of stuff.
Well, they think
That's where
that's
my
so
head was
good.
going. Yeah,
Yeah.
yeah, yeah.
Yeah.
But then you like to your point, you can't fake the IR, right? Like
Yeah.
yeah, so you'll like IR them and then it's just like all their tibia just like externally rotating or something like that. So it's just like knowing what you're, I guess, what you're looking at.
You,
But
you
they're
do.
tough. It's
Yeah,
tough. Those,
well, especially because they can appear superhuman in some ways. Like you can have someone like that like deadlift a shit ton of weight a lot of times. And you're like, oh,
yeah,
awesome,
yeah,
they're in great shape. But it's like, okay, what's the cost of that?
yeah. And then there's like the hanging on the joints. Like a lot of like that's honestly is probably like kind of like me is like hanging out on your joints versus like using the muscular tension. Like that kind of that's the kind of person that I have in my mind. Like as we're talking here.
Yeah. When it comes to like the feet, when you see like two totally different feet setups, say someone's like got a real flat one and one's a little bit more of like late, like early stance, maybe more ER representation. What is going on there?
Yeah. So the flat one is usually like a ton of lower posterior compression. So rotating everything outward, and then their way that they're putting force down is kind of through the middle of the foot. Like the medial compartment of their ankle is going to be like lax for a better word, or eccentrically oriented. Muscle tissue, like connective tissue, is going to be very yielded in that situation. Versus the opposite would be someone who's tibia, right? Like is going in the opposite direction. So you're gonna have like a supinated bias to the foot. Yeah.
And so that obviously comes up to the pelvis, and that follows the same representation. So, with these kind of people, do you do a lot of like asymmetrical kind of stuff? Like you do a lot more stance leg stuff on the left, a lot more like late propulsive, or more like later stance stuff on the right?
It's probably going to be shown in the setup, like how I set up exercise is probably where you're going to kind of see it most. So like a split squat, for example, like I might like use the fencer position, right, to start them, and then they can kind of like have them rotate into the front leg. Because ultimately, we want to just get like the pelvis square without having people think about it too much. But yeah, it would affect the setup a little bit too, especially someone with like a flatter foot. I might do like something to like bias more forefoot loading. Like I know that's not going to be like necessarily like the relative motion way to do it, but at least it gives them the ability to create tension, so they can resupinate the foot a little bit. Is kind of how I will typically go about that. It's going to depend a little bit on the person. Same with like using like ramps versus like a plate under their heel, something like that, just to get some of the motion back. Well, also sometimes like if a person has like a very ER foot, is something underneath the first met so that they're
Yeah.
not driving everything down to the ground to get their foot contacts. We can kind of bring the floor up to them, if you will. It's like a kind of like a Gary Ward concept.
Yeah, I was about to
Um,
say I
bring the
love
foot.
his wedges. Gary's awesome.
Yeah, like his way to think about it, like apply stuff is makes a shit ton of sense to me. Yeah, so I kind of like think about it from that way. Is like what do they need, and how can I like constrain this so that they don't have to do weird stuff to get into position. Yeah.
Yeah. Now, from like a bodybuilding perspective, when it comes to like programming and trying to fight the compression that's going to happen, like there's compression
Mhm.
that's going to happen no matter what, right? That's what I try to tell people because we do get some neurotic people that come to us, I'm sure, and we've been neurotic. I'm sure you've been
Yeah, yeah,
neurotic
you
at
go
some
through it,
point.
man. Yeah.
And so a lot of times, like people, they don't necessarily want to like do all the things that can help, which I don't think is that much. Is really if you kind of do a couple things pre-workout, a couple things post-workout, maybe take 5 minutes before or 5 minutes after, you can alleviate a lot of the compression you cause. But what are some general strategies during like the workouts that you think people could apply to like minimize the amount of unnecessary compression? I mean, like we talked about before, like the alternating. I'm really big on alternating
Yeah.
presses and things like that. What are your thoughts on some strategies we could use in the gym?
Yeah, yeah. I like the alternating strategy. I think one of the things would just be the guardrails on the intensity relative to their goal, like what they're trying to do. So the intensities we're working at. I think volume is a big one. And like I think the general thought is like more is better for a lot. And I'm not saying in bodybuilding, I'm just in general, like more is better. So like if we can like get the same effect from just doing the right output, like I'm probably going to gravitate towards that. We use a lot of the breathing stuff from the perspective of it's going to set you up from a recovery standpoint. So like you mentioned, like after a session, like it might be worth it's probably worth your while if you don't want XYZ to bother you. Like, and we already know this thing works. Like, let's just do this, spend this 10 minutes doing the whatever, the breathing drill, the foam rolling, the self mobilization, whatever it is, because that's going to set your recovery up, right? Which is ultimately what we're talking about because like anything with training, right? It's what you can recover from that's going to give you the positive adaptation or, the adaptations we don't want. And then same thing you said, like even bookending it with like in the front end of the session, something to whether it's reorient things or just create a little motion so that you're starting off from like a better position. Like that's always useful. But I do appreciate that people like time is a factor, right? So like I might cut that aspect out of things a little bit.
Yeah,
Just
and
typically how I do it. And then the programming, like I mentioned, like the intensity, I think that's a big one, like that we've kind of been, that we kind of play around with a lot. It's a variable we try to control as much as possible.
yeah, bodybuilders and people like aesthetic goals, they really like it. I found. I mean, it makes sense if you can like have them feel like they're doing something
Yeah.
while they're trying to create that expansion. So it doesn't even have to be much. Like I just have them maybe do like a deep squat with some wedges while they're doing some curls from down there. Just really breathe in, trying to get some posterior expansion while we're feeling a little bit of pump in the biceps. A lot of times you got to trick them into doing the shit
Yeah, I got
that
you. Like you mean like
they.
yeah, using position, right? To
Yeah, that too.
and then
Yeah,
train the thing. Yeah, for
yeah.
sure. Yeah,
Are there
we
any?
use a oh sorry, one more thing I was to say. We
Yeah,
use a
go
lot
ahead.
of like the frog position.
Yeah.
I find like that's just very like whether it's elevated or like in like decline or whatever it might be, like using that in it's like interspersed with like their sessions like during their rest periods. We use that one a lot too. I just feel like to your point, like they feel like they're like kind of like doing something and then it's a position that like puts people where they have motion available so they can kind of usually get some expansion from that like that kind of thing, so we do use it in
On the
that sense
ground.
too, either on the ground or like even having their like knees on the ground and their upper body elevated on
Yeah.
something where it's a little more it's not even passive, it's just like changing the relationship with gravity, the
Yeah.
incline version, right? Like it's demand on your upper body, so like if we're
Yeah.
thinking pump handle, like it's for a lot of people it's going to be tough, especially under fatigue where you're breathing heavy or if you're depending on what you're doing, so
Yeah. I like frog breathing a lot. Do you use it for like all your archetypes? Because I use it for, I mean, I used it for Sergio, who's super wide. I know when I talked to Zach, he said he doesn't really necessarily like to use it with the wider structures.
I'm reckless, man. Yeah. No, well, to me, it's just like what at the very least, what do I think is happening is like we're creating center of mass back situation. You
Yeah.
know, yeah. I don't get it. There are times where I care more about the archetypes, but something like that, I'm like, you can get, I think, a positive outcome from it. And worst case,
Yeah.
you just try it and see what
Exactly.
happens.
That's the
Like,
best thing about what we do, right? As long as you
yeah,
can't fuck somebody up, but people are paying us to like try things and figure out like problem solve. So it's like you can't just apply the same thing to everybody. What do you think is like some of the most bang for your bucks moves? Most of my people, they know some of the basic positional drills. I would say personally for me, when I have somebody who comes and visit me, I really just put them on their side at first and just do some sort of decompression, whether it's with a yoga block or manual or depending on their setup, maybe we'll do something on the hip. So that's probably like my biggest bang for your buck. Do you agree with that, or do you have some other ones that you like?
yeah. I was gonna say side lying is always like a safe starting point. And then you just might have to manipulate like the position their hips are in, right? Where if there's something between their knees or not. But it's usually a good way to, especially like manual therapy, at least set them up for success and create some motion. I mentioned the frog position. I use a lot of different frog variations. I shouldn't say a lot. There's only like five, but it's basically like
Yeah.
changing the relationship with like
What are you doing with the
gravity.
legs?
Yeah, knees out wide, feet
These
touching.
why?
I just
Yeah.
just make try. I usually will set them up with like a triangle in their hands, like so they don't have to think about it,
Yeah.
and then let their feet mirror it. Yeah,
Are they applying any force at all into the ground or the surfaces?
yeah. So your hand, forearm, and inside elbow are like the contact,
Kind of.
and it's kind of like just like a gentle push away. Yeah,
Yeah.
gentle push away is typically how we'll do it. We do it in seated a lot too, like just a seated version where their feet are on in contact with the ground, hips are out wide. We'll use that one. I don't know the names for all these incline
Yeah.
frog. Sometimes I have them in kneeling, and then they're like on a bench, something along those lines.
Are you going to use that to drive more IR or more ER?
I think about it as like just challenging AP expansion.
Yeah.
Yeah, anytime your hands or feet are in contact with the ground, right, we're introducing internal rotation to the situation. So I just kind of like think about it from that perspective.
Yeah, I always thought of frogs as a way to introduce IR from an ER kind of base.
Yeah, exactly. Yeah. Like that's the kind of idea is like anytime you put we didn't talk about that with like the propulsive phases, but anytime your foot hits the ground, right, that is some degree of internal rotation, depending on where your center of mass is getting introduced to the situation. So that's exactly how I think about it with this. It's like you're introducing superimposing is like the Bill word, right? You're the internal rotation into the situation.
And that's something that people ask me sometimes is like, why am I so big on like internal rotation? And I mean, it does depend on the move, right? A lot of the
Mhm.
moves we do are kind of IR biased, but it like people are gonna like have compensatory IR try to turn something into an ER instead of like producing the IR force. Like why, like for I've had this question quite a few times, like why is it important to try to maintain internal rotation force when you are working out? And again, it's
Yeah,
a spectrum, right? You're never in now I'm in
of
IR,
course.
not in ER.
Yeah. I think about it from like the structure loading the structures that we want to load and then what happens chronically over time. Like I never want to say like if we do this the quote unquote wrong way that something bad's going to happen over time, but you are chronically loading structures, right? You can't say that we're not. So whether it's going to hurt or something bad's going to happen, who knows? But that's kind of how I think about it is dispersing load right over the areas that we want. It's just like we talked about with like the grip, right? It's like you either feel it in your pec, you feel it in your anterior shoulder, you feel it in your elbow. Like where do you want it? Like that kind of thing is really what we're how I think about things.
Maybe we can do something real quick, maybe like a practical thing. Let's say
Mhm.
we were to take like my typical person. Let's say we have somebody who's a little bit more on the narrow side, not like super crazy narrow to where they're like the yogi who can do all the crazy shit, but I tend to get a little more narrow. So we've got somebody who's narrow in game. What is your idea? Like if like again, a lot of people don't like to have a lot of shit to do. I mean, my people
Mhm.
do, but my general viewers, they don't want much to do. So let's say we were to pick a couple of movements for somebody who's just missing IR across the like shoulders. Maybe they have compensatory IR over the hips. They have a decent straight leg raise, but it's kind of fake. Again, obviously everything's super variable, but in general, most of the time we say move center of mass back
Yeah.
initially for somebody who's in that phase. Is that where you agree with that?
Yeah, so in that situation, I might start with something like I mean, I forget what you said about the how much motion they have to start with, but like a low diagonal sit, something along those lines, where we
Okay.
can kind of get things like length on the right side is how I think
Yeah.
about it. And sometimes we'll use those where it's more of an orientation where we'll kind of like blow that side open a little bit.
Yeah.
I think of it as like manual therapy. I don't know if that's the right way to think about it, but we're like driving everything back in that direction and then like a regular kind of like low diagonal sit because then you'll be able to at least get the verticality back on the right side. And that's for a person, right? If we're talking like the orientation you described, they're not going to have foot contacts, so we
Yeah.
need to use their knee as the
Also,
foot
sorry,
contact.
sorry. When we say we don't have foot contacts, what might you see? Is this somebody who might have like their right foot more in the outer part, or
Yes, exactly. Yeah, like usually like their tibia is going to be they're like rotated externally rotated relative to their femur. You might have like a valgus orientation looking kind of situation, whatever it might be. And if you try to put their medial foot contacts or get the foot contacts on the ground, the whole leg is going to orient inward with it. So if you're seeing that, you can one, maybe just put their feet out to the side a little bit, like we kind of already talked about, or two, it's like we need to use something else as the foot contact. That something else would be the inside knee in that
yeah?
situation. So that's why I would go to like a diagonal, like a low diagonal sit, just to like kind of reorient some stuff.
So the
Um,
inside knee, you're in a low diagonal on your right side, the inside knee of your right.
Down on your left.
Okay, okay, yeah. I
Yeah,
got you.
yeah, yeah,
Yeah,
yeah. So your left side's down. Yeah. And then
yeah.
you have like your elbow and arm is in a position where they have
Are you
motion
doing like a
available.
reach overhead typically with the right, or what are you doing?
No, right. So usually what I'll set it up. So you'll be like in a am I using the right term? Yeah, diagonal sit. So I'm in a high diagonal sit, and then I just kind of like drop down to the ground.
Oh yeah,
So I'm
gotcha.
keeping my right side here, so I'm keeping length, right? It's just
Yeah,
very like light on the ground, and then my
yeah.
right leg is keeping its kind of like reach, if you will. Um, so the goal would be just verticality on the right side is usually like a usually a useful move for that situation. Maybe some type of soft tissue stuff before that too,
Yeah.
depending on how strict they are. I'm a big fan. Like I know foam rolling gets shit on. Like I don't think it's like the answer for anything by itself, but it like let's be real. Like anyone who foam rolls like their quad, like they feel a lot better. Like so,
Yeah.
it's like if time is of the essence, you don't want to think about a lot of shit. Like I'm gonna probably give you a, I might go that route. But low diagonal sits usually like a good one in that situation, and then we need something to get foot contacts. So maybe yeah, I don't know. It could be anything like a hook line position, whatever. As long as
Now,
if they get their motion back, that would be like my next step.
so I want to talk about a wide in a second, but let's stick on the narrow. So the hook line, this is something I kind of want to talk about because you're really, like I mentioned earlier, you're really good at kind of diving into the nuances of these positions. So how might we do hook line, some variations potentially for somebody who needs to get out of the right side, get more like late propulsive ability there, like a narrow versus what are some different setups we could do for different options, or for someone who's a wide who's got, no internal rotation space. What are some things we could do?
Oh yeah. So yeah, just like specifically hook line.
Yeah, yeah. It's because most everyone, all my people
Yeah.
know hook line. I really love to talk about like prone propulsion, but m not everybody, not all my people
Yeah,
do
yeah.
that. But everyone does hook line. Yeah,
Yeah, so I think of it this is just the way I think about it. I think about like early, late, like we're either gonna like load this side or push away from this side. So if I'm like in hook line, my assumption is that they can get their foot contacts on the ground. So if there is any take home today, it's like you can get your foot contacts, but it's like your foot contacts on the ground. And then if we're trying to create like a later representation on the right, which would be an earlier on the left, it's like a very subtle hip shift, like a little subtle reach with your right knee forward is how I would go about that.
what would
Yeah.
you do with the arms, and what are some variations that you can do with the arms that change things?
Yeah, yeah. It's gonna depend a little bit. I usually start with elbows bent, just keeping the lever smaller, like versus like keeping the arm straight. But it's gonna depend a little on what I see. So if I have like an arm reach and like their pecs right start squeezing and they close off the front of the chest wall, like I might as simply as just like bring
Yeah.
their arms out to the side a little bit, like something along those lines. And then with the like the sacrum, like where you feel pressure in your back is if you're like you're creating like that later representation on the right, you should feel like you're getting a little heavier on the left side, but it's just subtle. It's very
Yeah.
subtle. But if you feel like your whole sacrum's coming off the ground, you're not subtle. You went too far. So like those are like that's literally how I think about it with any exercise, like any of these. It's like a supine cross connect. It's like we're gonna like create a right push so we can turn to the left. Like what happens? I get a little heavier on my left side. Like that's kind of how I think about pretty much all of them.
Yeah, that's usually the cue that I give. Now, if we had like say we just had a wide squish person who's like in the middle of nowhere, how might we do? Would you do hook line the same potentially, or would you maybe do something different? This is somebody who's in no man's land, peck pattern, or whatever you want to think of.
Yeah, I might in that situation. I don't know if I'd use hook line, but if I were, I'd have their feet kind of out to the side a little bit in more of a, I'm gonna say like the fencer position, but putting them in that or like a sumo position, so they're like their feet would be wider than their hips. That might
So
be a
what?
way that I go about that. Yeah.
So what's something you would start say the opposite now? Now we got the wide person. We'll go through this quick, like the in-game wide person who potentially is starting to close down on their left a little bit, which as we talked about, as we start to move out our base support, the different archetypes do different things. So this is somebody whose, feet are splayed, they're kind of pulled slightly down on the left, kind of at their in game. What might be your first approach with somebody like this?
Yeah. Again, a diagonal sit. It might be a start, but a low diagonal sit because we got to create length now, right? On the side that's closed down. So we got to create that like space, if you will, for motion to happen. And then like I know it's like not a great answer, but like you kind of see how like the person responds, which is where I think a lot of this stuff gets like a little bit tough. Because once they respond, like how you see how they respond, the goal is like we either have foot contacts or we don't have foot contacts, essentially. And then that's going to dictate where I go. Like I use a lot of like oblique set positions, things where again where like we're keeping the joints out of the sagittal plane, if you will, right in
Yeah.
front of their body. We're keeping it out to the side. That's generally how I'm going to kind of go about those is some kind of thing to reorient things and create space and then gauge what happened and then we can make a decision.
Would you do something like a 90-90 over hook line just because maybe more paraspinal inhibition, their pelvis is more dumped forward potentially?
Yeah, maybe.
What would you do
maybe I
to
would
kind of
say.
help reorient the pelvis, sort of move their center of gravity back?
Yeah, we use are you familiar with supine like baby position?
Yep. Yeah.
Yeah. DNS, what is that, like 3.5 month, maybe something like
Yeah.
that. We use that a lot in that capacity. So like to right, so you're basically like an upside down frog position,
Yeah. Yeah.
because you can then support their feet on something if it's like too much pressure. But it kind of like does what you just said, right? It reorients everything backwards, and then they can pressurize the system. Like that's another one that we use pretty early with a lot of people,
Yeah.
narrow or wide. Yeah.
I like that. I just started not that long ago using that. I've seen Zach do it a few times, but then it's like one of those things. You'll see something and then you're like, maybe this will fit in here, and then you do it. You're like, oh, I could have like that in quite a few people
Yeah,
a
yeah.
while earlier.
I find that useful because for what you just said, man, it's like I know it's vague, but like center of mass forward, and people don't have like that reference. Like they can't even like you try hook line, nothing really kind of works. They can't get their pelvis to orient, like change position, all that kind of stuff. They can't get a sacral base to yield, all that. Like you just put them in this position, and like you can start to see like the rib cage starts moving, right? They can like we call it repressurizing. I don't know if that's like the way to do it, but we they can pressurize like their thorax and their pelvis, and then you usually a lot of motion kind of opens up for them, and then you can have access to some more stuff.
Why is it bad? This is a question I get all the time. Why is it bad? What is the issue with compressed ribs? Like people that don't know this at all, they still think the big arch, and then there's even some really big like influencers, people out there that really promote, to try to line up muscle fibers, create this kind of an extension, an archetype, which I mean, everything could have a slight application, right? But again, there's a
Yeah.
big cost if we're doing that every single time. For somebody who isn't educated in this that much, maybe because you can explain this much better than me, what like
We'll see.
why does our rib shape even matter as far as from like a pain management perspective, but also like a muscle building and aesthetics perspective?
Yeah, to me, I think it goes back to what we talked about earlier is where load gets placed on our body. If we're creating a situation and the adaptations that are going to happen, if like your strategy for everything is to close off the backside of your body, like you're overloading, right, your spinous processes, right? You'll have like a lot of tenderness there, like the connective tissue in that area. It's going to have implications for your neck, your hip motion, your shoulder motion, all that kind of stuff. And again, like I don't want to paint the picture that like this is always going to be like a bad thing, but you are creating a situation where you're placing focal load on structures over time, right? So there are going to be things, potential for all that stuff is going to be very, very real. When your center of mass is always pushed forward, it takes up joint motion. Like it just does. Like this is like, I don't know if it's like a thing that's even debatable. Like it's going to change the orientation of your femur relative to your acetabulum. It's going to do the same thing up in your shoulder, right? So you're gonna lose certain joint motions, and when that happens, right, if you keep doing the same things, you're going to overload different structures. Like that's kind of how I think about it in general. And then the thing about the rib cage is like think about your bucket handle, right? Your lower ribs, they're very mobile. Well, ideally. And it's a place that we can make a lot of change very quickly to your entire body. Like, of course, it's going to depend on the person, but that's why people care about like your ISA, and they care about like pressure, and they care about your guts and like where like their ability to go up and down versus like getting shoved down and forward. All that kind of stuff is because if we can create a situation where the rib cage moves or like the ISA is more dynamic, then you're going to probably see more motion in general throughout the body, disperse force a little bit differently everywhere.
Yeah, and that goes into the aesthetics too, because that'll like if you're not having upward pressure, then you're gonna start having maybe not the best presentation of like your guts. That could be kind of making you look like you
Yeah,
got a little more than you got, and that's never good on stage. And then also it's like,
that's a
go ahead.
I was gonna say that's a good visual representation, right?
Yeah.
Is like when you're like this person's got like 3% body fat, like they're obviously like don't have a gut, but then it looks like they have like this big gut. It's like that's what it is. It's like your organs and
Yeah.
fluid in your abdominal cavity is just it's pushed forward. There's nowhere else for it to go.
Yeah, that's just your viscera. That's not your belly fat. But
Yeah, yeah.
again,
It's not belly fat.
but and people see it because there's like a lot of times the bodybuilders they say don't relax, and like as soon as they turn stuff off, but it's like that's because they're not in a resting position that if they turned it off, it wouldn't necessarily go there. Like I could just stop and my gut's not going to flop over my my pant line.
Yeah, yeah.
Now. Also, it kind of goes into my opinion like regional hypertrophy too, because you'll see like a lot of people when they just kind of let go of the rib cage, they're kind of not creating like an action, especially on the muscles that attach to the rib cage, right? Like it's gonna be hard to get a full length and stretch on your lats if you're stuck here. It's gonna be hard, especially to get the sternal fibers. So, do you think that can impact like regional hypertrophy, how you're actually building the muscles?
Yeah, I think so too. Yeah, and if I understood the question correctly, like I think just I mean, yes, but getting your shoulder blade to move through like a full excursion. Someone explained this to me once. They were like, your pec, just think about it moving at like you think about your scapula moving. I'm like, oh yeah, that kind of like makes a lot of sense. So like I think about it very much in that is like you needed to go through excursion, right? So like load the different areas of the tissue. So yeah.
And just real quick, that makes me think about the programming talk you've had a lot too, right? Because it's everything you're doing is even if you're not like I don't retract hard, but I'll be pretty depressed in a good stack when I press. But it's still always good to do something where you're going through that full glenohumeral like rhythm, the scapulohumeral rhythm, and like a landmine press or something like that. Do you program a lot of stuff like that?
Yeah, yeah, we do. Yeah, yeah. So we kind of just always make sure like our big thing is making sure that the execution and selection of exercise matches the goal of it, right? So if output is the goal, like like that's one thing. But if we want to get like a person's shoulder blade moving through like fuller motion, like we program a lot of incline presses and a lot of landmine press variations. Even with kneeling pull downs, we use a lot where we can kind of like have a passive like creation of the length, if you will. It gives them like a different reference for it, and then they can kind of pull from there. So we get a lot of that kind of stuff for that reason.
Yeah, sometimes to start with the pull, just for them to like feel it. You're right. That's real big. Are you
Yeah,
doing much of the upper body yielding stuff? Are you doing like the cable presses and stuff?
yeah, yeah. We use cable presses. We use
But I
a lot
mean,
of
to
that stuff
create
too.
to specifically facilitate the yielding actions of the upper body. I
Do
I have
you
a
have an
little trouble
example?
program. Maybe say we're doing like that, like the left cable push, where we got the right reach and we're in that kind of left stance position.
So keeping the left side back.
Yeah, yeah,
Yes,
yeah,
yeah, yeah, yes, yeah, yeah. So meaning like you have a reach where you can reach and your sternum turns away and
yeah,
where your reach stays or your sternum
yeah,
stays. Yeah,
exactly.
yeah, exactly. Yeah, yeah. So
And
we
so
do that. Yeah.
you program a lot of those. So that's something I'm always trying to like play with because that's something that is hard to necessarily feel a lot of bang for your buck from for like my people. But sometimes it's like sometimes just like especially if you're really tight, like force is what's going to change you a little easier than just breathing if you can manage things with it.
Yeah. And I find what's tough with those, to your point too, is that you need like motion to do it, you know?
Yeah.
Like a lot of people can't put their feet, well, I mean you could put them there, but like in the context we're talking about where you have your feet right underneath you, right? And they're pointing forward to
Yeah.
like even get in a good position for that. So in that sense, we do use a lot of like like I mentioned before, like the chopping
Yeah.
variations, just because you're unweighing, right? And you can like turn into that side a little bit easier. So we
Yeah.
tend to go that route more.
You
Yeah.
tend to do more like just lateral chops from like a wide base, you're saying?
Yeah, we do in general, we'll do different chopping variations, but I've like especially for like people who are just athletic and like they just like do cool shit with their body, like tends to like have their feet out wider, like tending to have the we tend to go the route where they have their feet out wider and they can kind of like load into the hip. Yeah.
So this the easiest chop for someone who's trying to get out of the right side, would that be like facing the cable and bringing it down towards the left?
Yeah, yeah. So you'd be like kind of like in a fencer stance with your right leg on the inside and the cable above you. So you're pulling down towards your left heel.
Yeah. I like that's really the main chop I use. I don't like I said, my people are more about like getting work in, but I do think I want to start incorporating a little more of that. Now, one thing I wanted to ask you too, real quick, is with this field, you know, it's kind of like anything. Like we have the really successful people that are getting their clients results, and there is like studies and evidence out there, but I feel like a lot of people still kind of like chirp like, oh well, what's the evidence-based studies, where's the peer-reviewed studies for all this, like does that really make a difference, like we have all these studies on this stuff on back pain. So what do you have people that actually like approach you with these questions, and then if you have someone who does, like what do you have studies that you like to reference or things that you like to point people towards?
Yeah, I can send you the reference list for our mentorship program. Yeah, it's like you're not going to find one study like on and be like compression expansion model is works. You know,
And
like that
these
stuff
studies are
doesn't.
about the rib cage mainly, right? Rib cage,
Yeah, it's
pelvis,
like rib
okay.
cage, pelvis, biomechanics. Do I have them here? Like there's some textbooks, like biomechanics and human movement. Like these are, it's just like taking that information and combining like a lot of different stuff is kind of how I think about it, you know. Like the physics component of things is another reason I gravitate towards Bill because it just makes a lot of sense to me. And then like I think it's kind of hard to argue with a lot of the fluid stuff he talks about. Like I get the way he's like explains it. But I when you start thinking about it from that perspective, to me it makes a lot of sense. And again, I'm not saying I'm like, you know, I'm like what do I know? But like I think it's kind of hard to argue from that perspective. Yeah. It's
Do
all
you feel
movement. It's movement related, like the training qualities, like connective tissue qualities. Those are all studied things. I mean, I don't know, you know, like fascia, like it's a thing in your body. It's connective tissue. Like we don't have to make it something it's not. You know, like like a focus of training, but it does like have qualities to it, like all that kind of stuff. You know, so
so you never hear that? You never have anyone who like tries to like give you the
I just
evidence-based
get
argument?
the main thing I'll get is like anytime I talk about an SI joint. Oh, it
Yeah,
just
oh,
has
it
two
doesn't
to four
move.
mil. Yeah, I'm like, okay, that's fine. We'll think
No one
whatever you
said no
want.
one said
Like,
it moves a lot, but it
yeah,
matters a lot.
yeah, I'm like, but I get it. Like, and again, I never post content to create fear and make people
Yeah.
think like, oh my God, like if your SI joint doesn't move 4 millimeters, don't do anything. Like, no, that's not it. I'm just saying it's a conceptual framework that I have for how I view movement. Like that's it, you know, and I will not get into arguments on the internet with people about that
Yeah.
stuff. I
No, I
just
don't
literally
see you
don't.
doing that at all.
I literally don't care.
What is your do people because I've gotten into that argument before too, where people are like, well, you don't even know what's happening. Well, I'm like, well, I'm not measuring what's happening at the SI joint, but between looking at the whole system while they're going through movements, you
Yeah.
can kind of tell if there's relative motion occurring at the sacrum, and if there is, then you're going to know there's some potentially some movement in the SI joints.
Yeah. Yeah. So the way that anytime anyone ever, like if someone questions it, I'm like, they got the outcome they, or they didn't. Like, that's what I stand on. Right. No,
Yeah.
for real. Like, you know, like, I don't mean to be dismissive of it. Like, it's the mental framework that I think about things through is like, okay, here's pressure here, here's pressure here, like in the sacrum in like a hook line drill or something. Like, this is my thought process of why I did it. This is, they're executing it in a way that I think, and then I measured their joint or their strength or whatever, and it improved or it didn't. Like, that's how I kind of think about things. It's very like to make a decision, right? This is very much how I kind of approach things. So even if like the SI joint has no movement at all, and like I literally don't care. Like it doesn't influence me, you know. I'm like, well, their hip felt better, so whatever you want to think happened, you know. Yeah.
Maybe when, real quick, when we say fluid dynamics, maybe we can explain. Most of my people kind of know, but they might not exactly understand what we mean when we say fluid dynamics and moving around. Can you just briefly touch on that?
Yeah, yeah. So the way I think about it, like, is the joint at the joint level. So you have like synovial fluid in your joint. Maybe we'll do like an elbow. An elbow might be like the easiest way to see it. You have fluid in it, and when you flex and extend your elbow, the fluid's going to kind of move into the area where space is available. So you have compression on one side. If I like flex my bicep, can't be flexing my bicep in front of you, man. This is a runner biceps, man. Runner biceps from a runner who does a lot of bicep curls. So we have a you're creating compression or high pressure situation on the front of the joint. So you're right, fluid's going to get pushed away from that. Same thing, right? It's like you extend your joint, you're creating more pressure on the backside, so now fluid can kind of move to the other side. So we talk about like pressure, like that's what we're talking about, how it affects flex fluid or fluid dynamics. I mean, it's like affected by pressure. You have the same thing kind of happen globally, but it's the same general concept, you know. And if we could think of fluid, we can also think of air. So it's like reach here and your sternum goes away. We're creating space, so it's a higher pressure situation on like the back of the rib cage, lower pressure on the front, so you can get push fluid forward or air forward in that situation.
So something we see a lot of times with the elbow pain is, golfer's elbow or tennis elbow, right? Whether it's on the inside or the outside. So that might be a good example, like of how like orientation of the joints can affect the limbs and the fluid dynamics. So what might cause somebody to have a little more pain on the inside of their elbow? What's going on like at the rib cage and the shoulder?
Yeah, so probably some combination of loss of motion at the shoulder. So you're going to lose your ER/IR. So what has to happen is you're going to pick up more either at the bone, right? Your humerus is going to have to twist more, which will change the relationship at the forearm and the elbow. You can also get a bigger twist at the oh my God, the radius. My brain's shutting off now. At the radius, where the radius, kind of like your tibia would bow, like your radius is gonna bow. So you're going to have a situation where it might be got to create length right on the radius. Um, these are also going to change wrist, what happens at the wrist. So your ability to get your like hand contacts, if you will. So it's going to be some combination of those types of things. So usually the way we start is maybe something local, depending on the person at the elbow, just to like create the opportunity for relative motion or to create space in the joints. And then something proximally at the rib cage to create expansion so that the joints above can kind of move. And then how we put their hand on the ground, like where we put it and that kind of thing is going to be like the general solution. Like, I don't know how much more I can ramble on this, but if you want,
No, no, I was just curious. Like, I was
yeah,
curious if the humeral position will kind of dictate
yeah.
whether you're going to have more of an inner elbow pain or more of an outer elbow pain based off of what's going
Oh,
on.
yeah, I would imagine it would be like your knee. It's funny, I don't think about it from that perspective, but you're gonna have so let me think here for a sec. You're gonna have like an ER of the whole system. So you're probably gonna have more of like I guess a lateral like compression in that situation. Yeah, that's how I would kind of think about it.
Yeah, because
If it's
right.
like ER on ER, right? So everything kind of like orients outwards and you'll have like a bigger carrying angle. I would think that would be maybe the situation there.
Thanks. And then one last thing, I'll let you go, brother. I really appreciate your time.
Yeah, of course.
Unless there's something else you want to put out. I really, I've seen you put out a lot of stuff about your journey, how you've evolved, and you're really honest about it, which is was really cool. And you talk about, if I'm not mistaken, like, the struggles, imposter syndrome, and like questioning
Hmm.
things as you were building up what you've been doing. So, and now you're one of the men. You're one of the guys. You're probably one of the newer guys too that have really become on the forefront of this whole compression expansion model. I mean, Zach and Pat and all them, they've been around for a while. So, like, how did you deal with that? Did that come with like just getting more skilled? Because for me personally, that's a big part of it is the
Yeah.
results you get. But also, I've heard you talk about like getting better at like speaking and teaching as well. Can you speak a little bit on that real quick?
Yeah, I think part of it is what you said, man, is like kind of like proving to yourself that you can do it a little bit and getting reps. I think that's important. So there probably is a little truth to like if you feel like you can't do something, like maybe you've never done it before, right? So it's like then you do it and you're like, oh shit, I can kind of do this. But something I've also kind of learned is just my mindset around things is like anytime I feel resistance now, I kind of lean into it a little bit. I'm like, all right, this is probably just like a new thing I haven't done yet. Like I have
Like
this track
internal
record.
resistance? You mean like
Internal,
you're
internal
yeah.
resistance, like in my head, like, oh, it's kind of scary. Like, oh, I got to talk in front of these people. Like, oh shit, I don't know. Like, what if I say something stupid? What if I come on here? I probably said stuff that people are gonna be like, what the fuck's this guy talking about? I don't even know. But it's just like this just is what it is kind of situation, right? And what I've learned from people who like put out content and who are uh doing things and like trying to get better, it's like you just kind of like have to like I know it's easy to say, hard to do, but like, you kind of just have to like do it and view it as a learning experience. Like there are things that I talk about now that I did not believe, a year ago. There are things that I put out 2 years ago when I started or three, whenever I started going on social media, and I'm like, I probably do that differently now. It's just like part of the journey, man. And there are people who I've had people who like would send me a video and like this is wrong, and I'm like, yeah, dude, I said that 4 years ago. Like I don't fucking know what I believed 4 years ago. So I just kind of like think about it from that perspective. It's just like, very like here's the experience. Like I'm gonna learn from this and I'm gonna grow from it, and then I'm gonna think differently tomorrow. So I think it's just having that kind of perspective, man, has been the biggest thing for me.
Thanks. Is
And then
there
track record, like you said,
yeah.
like just like you've done it, like the SI joint conversation. Like I literally don't care to have that with people because even if it doesn't work, like I know that I can help people with the way that I'm thinking about things.
Yeah. I'm sorry. One more thing I was thinking of real fast that I forgot to ask is was just with the like inhalation strategies when we start to get really elevated and start to get a lot of neck pain. I would say neck pain is probably one of the most common things I see with
Yeah.
bodybuilders. In your opinion, is it best just to kind of like try to get the system, the rib cage pelvis to line up? Are you doing a lot of stuff directly for the neck, or are you kind of waiting to see if that falls into place? How do you approach neck pain? Besides, and the
Yeah, yeah.
manual therapy obviously is big for neck pain.
Yeah, that's like an easy one. Is the manual therapy. But I do think about it, it's like the like trap development, right? It's like the elevation. This is big in runners too. It's like this kind of situation. You're gonna have a like you got to reorient everything the other way. So we got to create space up in like this area. So between like the top of the scapula and the clavicle. And then one thing that I am mindful of is just this would go back to like execution of exercise and intensity is being mindful of like where we might draw the line with something like a press. You're going to get to a point where you're going to shrug, right? So I might just like cut it there. Same
Yeah.
with like a row or a pull. It's like if you go past, like a lot of people don't have a ton of humeral extension. If you go past it, what's going to happen? Your whole shoulder girdle is going to ride up. So like if that's the issue, that might be something early on in the process of someone dealing with neck pain that I'm trying to control for a little bit because it's very modifiable, and then kind of like rebuild from there. Yeah, a lot of times like too, it's like it's anterior expansion to reorient, anterior posterior expansion to reorient things, and a lot of it is driven by typically like lower posterior compression.
Yeah. What
Yeah.
is your favorite move to get the upper kind of dorsal rostral area as we start to like move up the chain to get expansion, like you're talking about in the higher parts?
Yeah, assuming that they can get in
Yeah.
position, you're gonna hear me talk about it. I like the frog position a lot because it's something that I think can apply is applicable to a lot of people. Um, I'll use inverted on a table a lot, so it'll be how do I describe this? Like basically, we got to get their pelvis higher than their head and shoulders,
Yeah.
and their head is in a relaxed position. So think of like you're like an upside down V almost,
Yeah.
and they're very relaxed position. Like I'll use that one if I'm in like in the treatment room, like in a clinic, and
Nice.
I have something like that. A lot of high low tables, you can kind of like make them in that
Yeah.
shape. Is very very useful as well. You can
Yeah.
kind of recreate it on your own, like you would need like I don't know, like a foam roller under your hips. You would need a lot of stuff though, because then you got to
Yeah.
also like you can't have shoulders kind of like riding forward. So it's not like ideal if you're trying to make it on your own, I would say. So ignore that last part there. Yeah.
Yeah, I mean, a lot of the inverted stuff is great, but like you said, you got to like work your way up there. I see people trying to invert like way too
Yeah.
early. Awesome.
Yeah, if you don't have the motion. But essentially like anything where you can even like some of the sidelining stuff you talked about before, it's like as long as you can get in sideline, you probably have to have some stuff under your head. As long as your shoulders aren't like you're not like laying on your shoulder, like where it's under your arm, like as long as you can keep it down, you'll probably get some of it, some AP there as well. Um,
Nice. Yeah, thank you so much. Is there anything else you want to put out there? Anything you want to let people know about? Or anything you have to add before I let you go, brother?
yeah, if anyone has questions, I'm always down in the DMs, man. They fill up a lot these days, which is, as you've experienced too. But yeah, like my Instagram is probably the best way to catch me. I'm always happy to have conversations, and if I can help out, I will, or if I can, I'll get you to the right person. So I
What's your
appreciate your time,
handle?
man.
Is it
It's
your name?
yeah, my name, Dr. Shaun Astorga with like a period in there. So Doctor period Shaun period Astorga. Man.
Nice. Like I said, probably the best as far as getting in depth if you want to really learn the nuances. I have so many of your posts saved, brother.
Oh, I appreciate it. It's funny because I like pride myself on being able to simplify everything, but then people tell me that like the nuance of it. I'm
Well,
like,
it
oh,
is. It's
okay.
you simplify the nuances, right? And
Okay, okay, cool.
you
Yeah,
break it
yeah.
down in a way that people can understand. So again, thanks for everything you do, brother. Thank you for coming on. It was a really good chat.
I appreciate you, man. Thank you.
All right, have a good one.
All right, I'll see you, man.